See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
Almost 9% of our entire U.S. carbon footprint is from healthcare.
I was horrified at the way that we handled resources and did not think about pollution.
This is despite the fact that the health sector is really on the front line of managing climate impacts.
We're taking care of folks every day that are experiencing these health exacerbations from climate change and planetary health issues.
We are always looking upstream at the social determinants of health, and now also to try and look at the environmental determinants of health, which overlap but are also distinct.
In October 2020, the NHS became the world's first health system to commit to reaching net zero emissions. There is impact that we can have in looking at travel, in looking at the products we use, in looking at the clinical pathways that the patients we serve go through, in looking at where we provide care, how we provide care, how we include and involve nature in our care.
Really, what's at the core is to align sustainability strategic planning and initiatives directly with what their health system is focusing on as an organization.
Welcome to See You Now. I'm Shauna Butler. The roots of our contemporary environmental and sustainability movement can be traced back to marine biologist Rachel Carson's 1962 landmark book, Silent Spring, which brought environmental concerns to an unprecedented share of the American people and spurred a reversal in national pesticide policy, led to a nationwide ban on DDT and other pesticides, and inspired a grassroots environmental movement that led to the creation of the U.S. Environmental Protection Agency. Climate change has become the greatest threat to future health, with the World Health Organization naming climate change as a global public health threat. In this episode, we learn from clinical experts and sustainability champions how healthcare as a sector is leaning into the generational demand and momentum for environmental stewardship and sustainability in healthcare, and about the vast array of tools, resources, and examples of practicing green health.
My name is Shanda Demarest. I am the Sustainability Solutions Director for Practice Greenhealth and Healthcare Without Harm. And every day I work to support a team that helps our hospitals and health systems across the country reduce their environmental footprint as part of the mission to deliver really safe and equitable healthcare to all. This work for me is so personal. I come from a little rural town in southeastern Minnesota. I grew up along the Mississippi River. I was surrounded by bluffs and valleys and trees and rocks. I didn't quite live outside, but man, I spent a lot of time out there. And my family taught me to fish and hunt and garden and preserve. Came to nursing school, decided I wanted to study horticulture, actually, and so that put me on the path of trying to find out how I could merge this nursing degree with the environment and conservation and preservation. And I found Healthcare Without Harm, and over the years I've been so fortunate to build a community in this space, and that started with nurses.
I'm Dr. John Pearl. I'm the president and CEO of the Joint Commission. Joint Commission includes not only the U.S.-based activities, but Joint Commission International, which operates in 75 countries, and our partner organization, the National Quality Forum. We've become very interested in sustainability because it's a top interest of healthcare workers, and particularly younger healthcare workers who really don't want to associate with health systems that are not committed to sustainable healthcare. What better way to celebrate Earth Day than having our colleagues out for an eclipse lunch complete with
eclipse.
moon pie.
Say that again. An eclipse lunch where? Where did you guys host this?
The Joint Commission hosted an eclipse lunch for all of our colleagues on the top of our parking deck, and we're out there with appropriately moon pies, starburst, pop rocks, and other similarly themed candies that we don't endorse.
I have to say, John, that's pretty impressive that you guys did it on the rooftop. And yeah.
Well, there's got to be some connection to Earth Day and sustainable world, right?
I was going to ask everybody what their experience of the eclipse had been. I think that something that really came through is how many people all across the world got really super excited about our joint connection to our planet's experience, our connection in the solar system. And you could see that enthusiasm and excitement. And I think that's a really good framing, that when we see people enthusiastic and they see that we're really all tied together in that pathway of the sun, it affects all of us. It affects our health. But I want to start with you, Shanda. Why sustainability? What do we mean by sustainability, and how is sustainability described for the healthcare sector?
That's a great place to start. So in the work that we do at Healthcare Without Harm and Practice Greenhealth, we drive our mission forward with this concept of just imagine healthy people living in equitable and resilient communities on a thriving planet. We center people. And as part of that mission, we aim to transform healthcare worldwide to reduce our environmental footprint, but also so that our health systems are becoming an anchor for this sustainability. And in the work that we do at Practice Greenhealth, we have a network of over 1,700 hospitals across the US. We get into Canada a little bit as well. And we help them embed this sustainability into healthcare operations and into healthcare culture. So we aim to shift at a strategic level and drive this healthcare sector to lead from within and push that broader societal change and progress. And I'm happy to share a little bit about the history, because I think this is helpful. Healthcare Without Harm started in the mid-90s around environmental work with health systems, specifically around mercury. This work was started initially by environmental advocates, not folks within healthcare per se. And back in this time, hospitals were getting rid of mercury mostly by incinerating it. Mercury was showing up in thermometers and blood pressure cuff devices. And when we were burning mercury, that poisons the air, it poisons the water. And the same communities that are living around these health systems were having health effects. So Healthcare Without Harm built this coalition initially in Boston to tackle mercury and get it out of healthcare. And that led to a global treaty to remove mercury from global healthcare. But now we're in a very different situation. We're in a planetary health crisis now. And so the climate is changing. The oceans are acidifying. Global soils are eroding. We're inundated with microplastics and chemicals. And we learn more and more every day about how our health is harmed by healthcare's impacts. And so the reality of our situation is we are on a collision course towards a planetary health crisis. And this concept of sustainability and resilience for the future is really what drives our work at Practice Greenhealth and Healthcare Without Harm.
When you say those things, I feel myself, the stress levels going up, because it's pretty scary. John, as I'm listening to Shanda talk about that, I think so many times of the work of the Joint Commission. And I don't know that people necessarily understand the role that the Joint Commission and the leadership role. Why have you guys jumped into thinking about sustainability, and how have you guys jumped into it?
Shanda, thank you very much for the leadership that Practice Greenhealth and Healthcare Without Harm have provided in terms of recognizing sustainability not only as a planetary health issue, but a health safety and resilience issue. And it's really in that regard that the Joint Commission is jumping in as part of our HELP, H-E-L-P agenda. When you look at our vision statement is that all people will always experience the highest value, safest, high quality healthcare across all settings. And when you start with that as a framing for everything you do, it's impossible to ignore the incongruity between our missions of service to individuals and communities in the interest of their health, given the outsized impact that healthcare is having on planetary health. It's just dive a little bit into that. And first, I'll mention that the health agenda is an acronym, and it stands for H, health equity, E, environmental sustainability, L, learning healthcare, really all about the responsible use of AI, and P is performance integration, the notion that the surveys become less performative and more fully integrated with the day-to-day operations of healthcare. And this derives directly from my experience as a healthcare operator, having been in a large health system and seen the effects, particularly during COVID, on issues like health equity. But I have a confession. I didn't spend my professional life studying sustainability, and I always feel like I came in the middle of a conversation. So I've been working with the National Academy of Medicine's Decarbonizing Healthcare Action Collaborative. And once you are exposed to certain things, it's impossible to unring the bell. What do I mean? Did you know that if healthcare worldwide were a country, that country would be the fifth most polluting country? It means that we have two obligations. First, the United States, we're overachievers. We're 27% of that worldwide healthcare footprint. And almost 9% of our entire US carbon footprint is from healthcare. And it violates the first principle of medicine as an untoward, unintended side effect of our mission to do good. We're doing harm to the environment. And this becomes a health issue, a health equity issue, and a patient safety and resilience issue. So let me just dive into each of those areas. As a health issue, it's pretty clear that heat exacerbates cardiovascular and respiratory illnesses. But we've already seen that there are also vector-borne diseases that we never really even were familiar with in the United States. If you drew a string around the globe at the latitude of the US-Canadian border, chikungunya is in every state, in every landmass south of that latitude. And dengue is virtually now endemic across the United States. We had malaria outbreaks in Florida last year. As a health equity issue, the same factors that predispose individuals to adverse health outcomes are the same factors that render them more vulnerable to the effects of climate change, whether it's moving away from floods, whether it's the impact of losing fisheries in the South because of algae bloom, red tide, or whether it's heat islands and heavily built urban environments. These are individuals who simply can't buy their way out of harm's way. And then finally, because of this, it's a dual patient safety and resilience issue. According to the T.S. Chan School of Public Health at Harvard, 81% of primary care clinics were closed at least once in the last 3 years because of an extreme weather event directly attributable to climate change. That means at the time where communities needed these services most, their health systems were unable to support. And not being there is a direct patient safety issue. And tying it back to the Joint Commission, given that our mission is to improve the safety and health and equity of care, this is absolutely in the center of our wheelhouse.
I am eager to pile on here, some of that really important justification for focusing on sustainability. And one thing that we are exploring more in our work here is this concept of channels of appeal. How do we guide healthcare leadership to really center sustainability and climate action in some of their strategic planning? And certainly health equity is a very important channel of appeal, but there are other home run elements for sustainability that can help justify this. So, for example, millennials and Gen Zs, we do comprise the largest percentage of the workforce across all health professions. And Deloitte performs a survey annually called the Global Millennial and Gen Z Survey. And basically, year after year, we see these two generations identifying climate action and sustainability mission as key decision factors for why these folks are choosing to work in certain places. And so for health systems that are centering sustainability and health equity from an environmental perspective in their mission and in their strategic plan, that's a hook for these generations, not only bringing them into the healthcare workforce in the first place, but keeping them there and keeping them engaged and bringing them into that culture of the work that they're doing.
And John, one of the things that you talked about that you felt like you walked into the middle of a conversation, healthcare is really waking up. I think the generation of practitioners that you and I represent, we are not the first ones to come to this environmental sustainability party, But as healthcare is waking up to the opportunities, how can we improve the health in our communities by getting carbon out of healthcare?
Well, I want to agree with Shanda's terrific comments about channels of engagement. There are individuals who are swayed by the moral and ethical case, but there are other individuals who are swayed by the financial and pragmatic case. And let me just start by saying it's rare for me to go into a hospital and have individuals ask for more standards. But just as Shanda said, millennials, Gen Y, Gen Z, all asking for more attention to sustainability. In fact, let me tell you about two studies. The Robert Half Company found that individuals between the ages of 18 and 34 do not want to work for organizations who don't have explicit commitment to environmental sustainability. And just in January, the Commonwealth Fund released a report that showed that 81% of clinicians felt that their health systems should be doing more to address sustainability, and that they personally felt they should be doing more both in the workplace and at home to address sustainability. When you ask healthcare executives right now, what are their top 5 issues? Their top 5 issues are workforce, finance, and everything else. And given that workforce drives finance, this is one of the easiest and best practical things you can do to support your workforce for recruitment and retention, an overt expression of commitment and actions that demonstrate commitment to sustainability is a pragmatic workforce initiative. The second is that there happen to be unprecedented and likely once in a lifetime funds available to recapitalize aged infrastructure. But if someone came to you and said, we're going to pay you to be able to update the lighting, the HVAC, the windows, the energy plant, et cetera, for your own home, and it'll have payback to your operating costs within 18 months, you'd say, sign me up. It's a little confusing how to access it, but the Inflation Reduction Act provides this, and kudos to the Ohio Hospital Association, which has helped organize energy consultation to every hospital in Ohio to help take advantage of these unprecedented opportunities to address Scope 2 emissions.
And my experience has been a sustainability effort has been driven by somebody who's very enthusiastic, somebody's passion. It becomes somebody's hobby. And a hospital system or an employer will say, go for it. They'll cheer them on. But increasingly, that has moved into a strategic imperative and operational practice. Can you help tie those dots together, why this has moved into a strategic interest and an operational imperative?
So we heard John reference specifically some of the community populations who are already experiencing health inequities, individuals who don't have access to healthcare or have decreased access to healthcare in the first place. Climate change and planetary health issues are a disease multiplier. And so when we're seeing heat exacerbation, increased air pollution, those vector-borne diseases, those same populations will experience greater impacts. When we look at this from a community perspective, and this is something that I really want to drive home, oftentimes, and we're learning this more and more, when health systems have community-oriented missions or community-oriented programs, there's this concept where healthcare will do for the community as opposed to healthcare doing with the community. And so when we are aiming to increase community health and weave that into sustainability and environmental programming, bringing the community voice and appropriately compensating individuals for this and including them in the process is absolutely imperative. The last thing we want to do in this process is approach community engagement through an extractive lens. And I think that's something that as we learn more about how to bring the community into the space, crafting this from a co-design and collaborative angle is really, really important.
I think that sustainability is coming to the forefront, as Shanda really referenced, through multiple channels of engagement. There's a mission-driven attachment. It's a practical issue. It's a financial issue. We've seen the recent rule that was proposed by the Securities Exchange Commission for for-profit corporations to disclose. And so it's really clear that organizations are preparing for the public accountability. And for-profit, that means everything from the say on pay and shareholder activists to the formal SEC regulations. And for not-for-profit, we all know that best practices and regulatory oversight typically tends to flow into the not-for-profit governance responsibilities, just like Sarbanes-Oxley as an example. And so there are any number of reasons that this is becoming very mainstream. But one of my former colleagues at HCA, the chief financial officer, said this is just good business sense. And for all of those reasons, I think it's crossed the frontier from a nice to do sort of, sorry to say, somewhat fringe activity to a central, mission-oriented, financially relevant, and a governance-related activity. I've now been at the Joint Commission for 2 years. When we began talking about this the first year, there wasn't a great deal of positive receptivity. But Shauna, as you said at the outset, this past year changed things. We had the wildfires in Canada, and you could smell smoke from New York City to Florida and all the way west to the Mississippi. You smelled it in Chicago. It wasn't a future risk. It was a current risk. Wildfires in Maui, devastation that was unprecedented. 101-degree waters off the coast of Key West. Fish kills along the Gulf Coast that required the fishermen to move their work further north. Had devastating floods after 14 feet of snow in Northern California. We had atmospheric rivers that eroded the coast with pieces of the Pacific Coast Highway falling into the sea. In Montpelier, the Vermont Hospital Association actually was inundated with over 2 feet of water and mud and had to dig out. So this is no longer tomorrow's challenge. It's no longer optional. It's very central. And I would tell you this is why there's been great receptivity to our new sustainable healthcare certification, which allows organizations that haven't started to get started, gives them a framework, and allows organizations that have started to really take credit to that perspective and current workforce and their communities for the work they're doing. It really is only 3 major pieces: setting priorities by leadership and endorsing that at governance level, creating baselines and measurement in a number of important areas, 3 of 6 that are identified, and evaluating progress annually and taking additional actions as required. And just want to thank Healthcare Without Harm and Practice Greenhealth, National Academy of Medicine, and others for providing input as a starting place for this certification.
These things that you cite where people are experiencing very dramatic and immediate way these environmental changes and impacts and catastrophes, really, there is this growing engagement, awareness, and urgency surrounding sustainability in healthcare practice. So, Shanda, I want to throw this over to you because you are in this every day, deeply in the weeds or in the smoke or in the floods, I guess we might refer to it as, of this work of sustainability. What's working? How is the interest and the commitment being catalyzed, supported, and scaled?
Certainly in the last few years, we've seen the climactic urgency for this work, but the federal and sector urgency and momentum is just being blown out of the water. So in 2021, the Biden administration put forward an executive order, and that requires all federal hospitals and health facilities. So these are the VAs, the military health system, the Defense Health Agency hospitals. All of these systems are required to decarbonize their healthcare operations 50% by 2030, which is like tomorrow, and 100% by 2050. So we are working with all of these federal facilities to make that happen. Then the next year, on Earth Day, so this is 2022, Health and Human Services released a health sector climate pledge. And this was in partnership with their new office that opened, which is called the Office for Climate Change and Health Equity. And we worked with that office, they call themselves OCHI, to help recruit hospitals to commit to this pledge, which basically mimics the same executive order around federal healthcare decarbonization or reducing emissions. And that is open to all hospitals across the country. So now there are over 800 hospitals that have committed to that pledge. And not only is there an emissions reduction element of the pledge, they also are committing to climate resilience, and they're also committing to executive support of that work. So we're seeing this huge shift across the country where C-suite leadership is standing up and saying, we are going to reduce our climactic impact as part of our healthcare operations, and we're going to build a plan so that we are more climate resilient. And what that means is building processes to protect their built infrastructure. Basically, how does a hospital become more resilient to those floods and wildfires and extreme heat that we're talking about? How can a community around the hospital be more resilient to climate impacts? And some of that, from a health professional perspective, is incredibly important, because we think about patients who are not only seeking care within the health systems, but when they go home, they're still going to be exposed to all of these climatic changes. So how can actual providers and nurses be working to build plans for their patients to reduce their vulnerabilities to some of those challenges? What excites me the most about this is this executive support that the pledges are requiring. John, I know you're thinking a lot about this work, and we certainly have seen a major appetite across the Practice Greenhealth network for the Joint Commission certification.
On January 1st of 2024, we launched the Sustainable Healthcare Certification, and it's been very well received. We've already had over 40 health systems, hospitals, commit to the certification. Meridian, Hackensack were the very first health system to go all in on this, and we're working with others. There are really four major components in the certification. One is a strategic plan that's approved annually by the board. The second is to designate one or more leaders responsible for the operational plan. This is oftentimes a collateral position, often in the finance office, because there is a carbon accounting in relation to likely forthcoming disclosure requirements. The third aspect of this is to measure in three or more areas of opportunity: combustible fuel use, purchased energy, anesthetic gas use, fleet vehicle fuel use, waste disposal, and metered dose inhaler use. And then reduce the footprint in each of those areas and assess the progress annually and measure against goals and revise strategy if goals aren't met. So this is a starting point. Many organizations are going far beyond this. So as individuals who, by mission, by our personal calling to healthcare, want to help our communities, it's both our opportunity and our responsibility to really jump in. And I have to say, collectively as a country, given our national impact in healthcare against the worldwide carbon footprint, it's not only a national responsibility, it's an obligation.
I'm listening to all of this and I'm feeling my anxiety go up. I did hear you say the word help. We're here to help. Thank heavens, because it feels really overwhelming if I am leading a health system or I know I need to do this. And the Joint Commission, you have launched online sustainable healthcare resource center. What is that and what's listed in the resource center? I mean, how do people get started?
Go to the Joint Commission website. You'll find links to our Sustainable Healthcare Resource Center, which has a Sustainable Healthcare Priority page that has video vignettes from other leaders articulating both why and how they're taking it on, as well as a resource center that provides key strategies and tools and literatures and links. And importantly, I want to call out Shanda on the great work, Healthcare Without Harm, Practice Greenhealth, great sources of information. The National Academy of Medicine is also on the link, and they've held a number of carbon accounting footprints. So if this is complex and there's urgency, that's true. And, for all of us, particularly for someone like me, who's the parent of a Gen Z daughter, who actually has put forward the proposition that, do I want to have kids? Is the world going to be sustainable or not? It's our responsibility to make a difference now. And these are some resources for getting started. And I know, Shauna, you have worldwide listeners, and I think we should call out the Sustainability Center at the International Hospital Federation in Geneva, Switzerland. The Geneva Sustainability Center is an incredible resource, and their leader is a woman named Sonia Rushnick, who helped put together the action plan for the entire National Health Service of the UK. And what's really cool about this, and to quote my friend Don Berwick, is that the great thing about benchmarks is that they're not theoretical. Someone's already proven it. Someone's doing it. Let me call out Seattle Children's Hospital, which has eliminated essentially the impact of fluorinated hydrocarbons at Memorial Sloan Kettering. They've reduced their energy consumption by some high-tech stuff, but also some really low-tech stuff. They're in the middle of Manhattan in a building that is landlocked and older, by managing awnings, et cetera, and updating their HVAC. They've cut energy consumption by 30%. At the Cleveland Clinic, they've reduced energy consumption in the ORs and saved $20,000 by OR by reprocessing circularity, which is the reuse of materials. At the Ronald Reagan Medical Center at UCLA, they converted from disposable gowns to launderable cloth gowns. They've saved almost 297 tons of waste and over $1 million by making that switch alone. Others have actually done these things. And we want to sing the praises of the organizations with the certification for those organizations that are taking action and can really fulfill and communicate their commitment to community, commitment to mission through that certification, which, by the way, is virtual and done essentially at cost because we don't want to add to the carbon footprint and we want everyone to be able to participate. So less than $3,000 for 2 years.
Yeah, I was just going to say, if you're putting together a certificate on sustainability, you need to make it carbon neutral, I would imagine. So in that vein of talking about all the different things that are working, what are some of the things that you, Shanda, have been very specifically focused on?
Maybe I'll start with Alliance of Nurses for Healthy Environments, otherwise known as ANNE. So this group is the US's only nursing organization that is specifically focused on all things environment, climate, chemicals, plastics, food. It's led by Katie Huffling out of Baltimore. And ANNE basically works to educate and empower and prepare nurses to be environmental leaders in whatever area of practice or care they are in. Back in 2017, Alliance of Nurses for Healthy Environments and Healthcare Without Harm came together in capitalizing on this nursing interest to really make a big difference in climate change. And when we think about engaging nurses in climate change, certainly we want all nurses, all health professionals, but really nurses to take action and to have the tools and resources they need to reduce the environmental impact of their work, of their role, of their health organization, and thereby reducing the impact on human health. And so this program was called the Nurses Climate Challenge and was first an educational campaign where this program got the tools and resources into the hands of nurses to understand how climate change was impacting the patients that they were working with in their hospitals, in their communities, in their schools, and then gave them the resources to reduce the environmental impact of what it meant to practice as a nurse. And so now, over the last 6-7 years, that program has grown to be engaging nurses across over 40 different countries. We've educated collectively over 60,000 people now about what it means to be a climate advocate from the nursing perspective. And it's so exciting to see this profession just contributing to the momentum and really leading the way in our health sector. You know, we're taking care of folks every day that are experiencing these health exacerbations from climate change. And now the focus is more, how do we mobilize all health professionals to, contribute to this planetary healing?
So another really interesting place where you and John practice Greenhealth and the Joint Commission where you're overlapping is CleanMed. So what is CleanMed and why is it? Who participates? Do say more about CleanMed so we can find our tribe and get going on all of this work.
So CleanMed is the US's premier healthcare sustainability conference. There's an arm in Europe as well, but CleanMed 2024 is right around the corner. We're gathering at the end of May in Salt Lake City. And this is an event for honestly everybody. And the reason for that is because sustainability is everybody's role. To be more specific, we have folks there who are maybe traditional sustainability professionals in healthcare, sustainability directors, sustainability managers. These folks are leading sustainability and climate and planetary programming in their hospitals, in their health systems. And really what's at the core of the responsibility for these folks is to align sustainability strategic planning and initiatives directly with what their health system is focusing on as an organization. So that could be looking at energy reduction from a facilities perspective, waste reduction, chemicals reduction, aligning that with health equity and community engagement. But I sometimes think about these roles kind of like a nurse. It's the hub of the wheel. You have connectivity to every single department in the health system because sustainability and environmental impact shows up everywhere. And so if you have a sustainability director or manager or colleague in your health system, they are the perfect people to build those bridges with.
In talking about sustainability, you made a very important distinction. You were talking about designing with people. Mm-hmm. And when we think about the health equity, the social justice, our sustainability activities. So I want you to say more about Clean Med in the context of how is this helping us to understand and differentiate as well as be more active in designing with people, designing with our community, designing with our vendors. I feel like that is a really key insight that you dropped and we should pick up on.
Over the past few years, we've really deliberately tried to bring the community engagement element much more strongly into not only this event, but all of the work and the resources and the tools that we're building at Practice Greenhealth. From the Clean Med perspective, this year, we have a pre-conference on climate resilience, and we have a panel that is hosted by, they're called Shift Health, and they are a community engagement organization that is teaching us these co-designing and co-investing principles. We have several different sessions throughout the conference that are centering community benefits, community health needs assessments, these elements that are already living within health systems that we're trying to build the bridges and connect the dots around this environmental justice and environmental equity element. And so in the same way that sustainability is everybody's job, community and health equity is everybody's job. And stepping back for one moment, I think if there's a key piece that's missing in this work, and I would love to see more of these types of individuals at Clean Med in Practice Greenhealth programming of executive leadership of hospitals and health systems. Certainly some folks are showing up, but looking at some of our Practice Greenhealth data, I mean, in this last year, only 31% of our reporting hospitals had CEO or board of director requirement for climate reporting on mitigation. Only about a quarter of hospitals are incorporating climate into community health needs assessments. And some of what this data is telling us is that leadership is seeing sustainability still as separate from some of this paramount health organizational strategy. And so the better we can connect these dots and get these people in the same room, the better we can weave together environmental, climate, community, health equity, and strategic prioritization of all health systems.
You know, as I listen to the two of you, I feel a little bit overwhelmed. For somebody who maybe new on this journey, very excited, what's a good place to start? Where are some of the resources that Practice Greenhealth, Healthcare Without Harm, where would you go?
So many hospitals are at the beginning of this. We have a series that we just launched called the Accelerating Healthcare Sustainability Series. And this is basically a modular program where folks are able to learn about governance, data and goal setting, engaging leadership, creating a culture of sustainability, and collecting the core elements for how to build a foundation for sustainability program from the ground up. Another huge element of our resource suite focuses specifically around some of the climate mitigation that we've been speaking about. So we support health systems in quantifying their greenhouse gas emissions. This is an open source tool that anybody can utilize. And basically, it really breaks down what it looks like to measure the emissions that are part of healthcare operations across all of those scopes we've been chatting about a little bit. And we have a multitude of resources that help hospitals not only decrease those greenhouse gas emissions, but also reduce waste, purchase healthier and safer supplies, reduce toxic chemical use. The list goes on. Since sustainability is so broad, our resources in our toolkits are broad. And I'm really eager for folks to jump in and take a look to see what suits their needs, what suits their healthcare culture, and what their leadership is interested in pursuing as far as sustainability in their work.
Okay, first of all, it's awesome, but it also feels like it's very approachable. But the part of the series that I loved is how to get your executive leadership on board. I know that people have a sense of urgency and they want to get started and they're not really sure where. But one of the things that's so important is to have executive buy-in, to have executive support, for it to show up in a strategic plan, for it to show up in a budget, for there to be committed time that's compensated so that these practices, that they really do become a part of who we are as practitioners, who we are as health systems. And I'm thinking of very specific nurses, some of the work that they are doing. And one of the people that you shared with me is Jessica Wolf. What do you know about Jessica and what's she up to?
So Jessica Wolf, she serves as the strategy principal director for Accenture. And specifically, Jessica works around this scope 3 emissions reduction, which is like the black box of climate change. The work that she's leading is incredibly edge running, very complex. I admire her a lot for her ability to integrate the clinical elements that she's drawing from in her personal path.
Hi, I'm Jessica Wolf. I currently lead Health and Life Sciences Sustainability Strategy and Consulting at Accenture. And what that means is that I work with health systems and health insurers, pharmaceutical companies, and medical device and supply companies on reducing their environmental footprints and preparing for climate change. And this is all done through the lens of improving health equity and increasing health access, since that's what really sets the health sector apart. The health sector can't just decarbonize. They have to do that with the lens of the healing mission in place. The impacts of climate change are making it very difficult to provide continuity of services and business. And hospitals need to be available not only during extreme weather events, but after, because they're typically anchor institutions. So they're the largest employers in communities, and we see what happens when those hospitals close and the impacts that have on the people in the community. I always wanted to make the world a better place and wanted to be an agent for change. In college, I was an environmental studies major. I started a recycling program at my institution. I got out of college and I actually was working at the Nature Conservancy, looking at land conservation, and then thought, I need a human element to my work. I moved into farmland preservation. Pretty interesting work. And at the same time, I had discovered women's health. And I was really interested in the provision of women's health care from a feminist political perspective. I never wanted to work in medicine. I never had a dream to be a nurse, a doctor, anything like that growing up. But then I met my first nurse practitioner, and I was so moved. I ended up going back and getting both my BSN and MSN at University of Pennsylvania, becoming a women's health nurse practitioner, but always thought more holistically about the health of my patients and the environmental impacts that they were struggling with. So in the mid-2000s, we started to see some of the biggest companies. IBM had a Smarter Planet initiative. GE had an Eco-Imagination initiative. And I said, oh, companies are starting to really understand this as a strategic advantage. I need to solve climate change. And I decided I wanted to do that through the lens of business. So I was able to go back and get my MBA. And in that time period, I discovered that there was something called healthcare sustainability, which I'd never heard of, this little niche. And I was like, oh, this was made for me. My passion in health, my passion in the environment. So I worked on something called the Healthier Hospitals Initiative, helping to accelerate sustainability practices in the health system. I then worked as an environmental sustainability advisor at Dartmouth Hitchcock Health up in New Hampshire. And then I went into a role at Healthcare Without Harm, leading their U.S. climate and health program. And during that time, we did a number of initiatives where we used consultancies to support our work. And a few years ago, I was recruited into Accenture to help them grow and support health and life sciences clients in their sustainability work. Accenture is a global professional services and technology company. We have over 740,000 employees, and we serve clients in 120 countries. So it really aligned with what is my theory of change that came from working at Healthcare Without Harm, which is innovate, scale, and transform. One of the opportunities at Accenture is to work globally with some of the largest health and life sciences companies in the world to make change. We want to help companies establish strategies and goals that are aligned with their business imperatives. We want to help companies actually do the decarbonization of both their operations and their supply chains, which is very challenging. And you have to figure out, how do you best measure and analyze this data to track and improve performance? So it's very interesting actually working in a big company that serves all different sectors and being the person that works in healthcare, because healthcare has been really a laggard in this space. So a lot of times the work I'm doing is helping health systems get started. So doing their first greenhouse gas emissions inventory, measuring their scope 1, scope 2, and scope 3 emissions, helping them set targets for reduction, both those emissions reduction targets and potentially other goals like renewable electricity or reducing waste. After you set those goals, you have to figure out how you're going to get there. So we work with companies on decarbonization roadmaps or implementation plans and looking over time and understanding what are the initiatives, what are the potential reductions you're going to get from those initiatives, and what kind of investment you're going to need to get there, because you have to look at the financial pieces as well. And there's a lot of innovative financing available right now. And if you look, for instance, at the Inflation Reduction Act, a lot of opportunities to leverage now. So there's a window of opportunity. Some of the work that I'm most excited about is work that elevates the whole sector. For instance, we just officially launched something called the Collaborative for Healthcare Action to Reduce MedTech Emissions, or CHARM for short. And that is bringing together health systems and their medical device and suppliers to work together to help decarbonize that supply chain. And that is an initiative that I'm super excited about, because as you bring those efforts together, it's one thing to say to a company, make a more sustainable product, but we all know that the decisions of what to procure and how to use a product are made by the health systems. So there are many places where the health systems and their suppliers can come together to make a real difference in those emissions. Another example of work in that space is we're currently working on a net zero playbook for pharmaceutical companies. So really detailed work on what are the initiatives that will help both pharmaceutical companies and their suppliers reduce emissions. And that's critical work. Pharmaceuticals make up 12% of global healthcare emissions. I also had the opportunity to put together a white paper and a session at COP28. And this was really focused on how can healthcare providers use technology to decrease emissions while at the same time improving health equity and increasing access to care. So we wrote a white paper called The Digital Cure, Advancing Health for People and the Planet. And we had a global panel present at COP28 to talk about the many things that will bring improvement on all three of those pillars: less emissions, more access, and improved health equity. So those types of things are what make my heart sing in terms of the work I'm doing.
Another nurse, that is really blazing trails and guiding and teaching all of us to think about sustainability from a clinician perspective, from our clinical practice, is Emma Blakey at the National Health Service in the UK. Tell us more about Emma. What's she doing?
Emma, well, first of all, she works as the clinical lead for sustainability for NHS England. And the fact that she works for NHS England says a lot. It is the most progressive health organization just about globally when it comes to emissions reduction. And she's also a researcher. And so she works on a full team for sustainability leadership for the NHS. And she now is on a bit of a path to developing a nursing research agenda for climate action.
Hello, everyone. My name is Emma Pascal Blakey. I'm a registered nurse and I work within the National Health Service in England. The role that I have within the National Health Service at the moment is that I am seconded from my hospital, where I'd normally be working as an endoscopy nurse. And I work for NHS England, which is the sort of organisational side of the NHS. And I am the nurse lead for sustainability. So this is a brand new role. It hasn't been done before. It's an exciting privilege to feel like I get to make a difference in this way. My role is to support my fellow nurses and midwives who work within the NHS to understand what sustainability means to them, what does it mean to us as a profession, how we can support the delivery of our NHS's net zero ambitions. So let me tell you about the Net Zero programme. In October 2020, the NHS became the world's first health system to commit to reaching net zero emissions. And we have a report called Delivering a Net Zero NHS that was published. We have two main targets: to be net zero by 2040 for directly controlled emissions, and net zero by 2045 for emissions that the NHS influences. We cover the whole country, so we have quite a huge amount of reach in terms of what we can influence if we're thinking about our supply chain, for example. And we know that nurses and midwives have a huge amount of potential and opportunity to make change in all of those areas. We have nurses that work in clinical procurement that can help to support identifying and providing the right type of equipment for patient and clinical need, but also ensuring that it fulfills these net zero ambitions. So in my mind, there are a few things that make the NHS sustainability programme so unique and special. First of all, we were the first National Health Service to have these ambitions. So there's that innovative, that pioneering element to it. We have no one to follow. So we have the freedom to try things and to keep improving and to keep iterating, to keep pivoting. And I think we need to be quite agile in our thinking. We look to tried and tested approaches such as quality improvement principles, but we also have the freedom to think, how could we do this? And let's bring our colleagues together and come up with ways of working. So let's really take that co-development approach. We've done workshops with nurses, all the way from student nurses, nurses at the point of care, nurses in different organisations, midwives in academia, all coming together to develop direction and set direction for where we want to go with work. We also know that where we have the highest carbon emissions are around complex care and acute services. So the more we can do to prevent people requiring those services, we're improving population health and we're also reducing carbon impact. We're also looking to where we deliver healthcare. So does everyone need to come into a hospital environment for things? Or could we provide blood testing on a little bus that goes into the community so that people do not need to come back into the hospital routinely to get blood tests? You know, putting the right care in the right place for the right patient, doing primary and secondary prevention, all of those things that a lot of us within healthcare and clinicians want to do anyway, also has a benefit of reducing the carbon impact of our service. And so we have yet another motivation to put effort and resource into those things. In terms of nursing and midwifery involvement in research around planetary health and decarbonisation, One, I would love to see this be the motivating factor for more nurses and midwives to get involved in research and actually see themselves as academics, as scientists, as well as being clinicians. I think we have real opportunities for participatory or community-based research that's working with the communities, and we are close to the communities we serve. So we have a real opportunity there to do meaningful research to help identify the impacts that communities are facing because of the changing climate, and then what are the types of intervention or mitigation or prevention that we can put in place with them to go forward with health improvement models. So thinking about sustainability at a national level can feel quite overwhelming. It's so big. There is so much to do. Where do you start? And I think that's a fair point. And I think some of the advice I've been given is to pick something you're really good at, or pick one or two things and just do them really well and then move on to the next thing. So we don't have to, all of us, try and do everything at once. If we look at the carbon footprint of the NHS, there is impact that we can have in looking at travel, in looking at the products we use, in looking at the clinical pathways that the patients we serve go through, in looking at where we provide care, how we provide care, how we include and involve nature in our care. And there is space for everyone to make a difference. And if we imagine the many thousands and thousands of nurses and midwives in the National Health Service, and every single one of us did one thing, the impact would be immense. So we have not only our number, but also our reach. We have people working in primary care, looking at the type of inhalers that people use. That's an opportunity for people to have those conversations to improve respiratory health for that particular patient. We have people using electric vehicles to get to their different appointments. We have a health visitor that cycles around when she's visiting the families in her care. We have chemotherapy being delivered to the Isle of Wight by drone, reducing the need for the boat and the driven vehicle to get there and saving time as well. We have solar power being used in certain hospitals. We have bike couriers, so people on pedal bikes couriering different things around different hospital sites instead of using cars. We have reducing single-use plastics in a children's hospital. So we just have a huge amount of different types of project going on. And I think if I'm learning anything in this role, is that for me, achieving a net zero NHS is vital for our population, for our planet. But I would love for nurses and midwives to come away recognizing that actually they're already doing a huge amount to get us there. And we need to own that and be more visible about it. The work we do in prevention, the work we do to quietly improve services and processes and ways of working, I would love to, through what I'm doing in this role, help amplify that work that's already there and support nurses and midwives to find their niche, find their thing, and just keep doing it really well for the benefit of their population and the planet.
Another trailblazer who's really helping us to think about sustainability, Beth Shank. Shanda, tell us more about Beth Shank. What's she up to?
Beth, she's now a nursing researcher at Washington State University, but that's just her part-time job. She leads executive sustainability programming across Providence Health, which is one of the largest health systems in the United States, mostly in the Western states. And Beth has built a team of sustainability professionals from the ground up, and they are aligning their work with the organizational strategic plan. They are blowing the competition out of the water. It's unbelievably impressive what Providence Health has committed to. They are focusing on full greenhouse gas emissions reduction by 2050. There aren't a lot of health systems in the United States that are doing that. And Beth has led her team to commit to that for Providence Health.
I am Beth Shank, and I'm the Chief Environmental Stewardship Officer for Providence. Providence is one of the largest nonprofit health systems in the United States, with 51 hospitals and over 1,000 clinics in 7 Western states. We have 120,000 caregivers, 38,000 of which are nurses. And we have taken on a significant interest and commitment to environmental stewardship. We're excited in Providence that the Joint Commission established this voluntary sustainability in healthcare certificate, and all 51 of our hospitals are doing it. And this is really related to our core values and our mission that goes back 175 years or so of offering many, many types of services in the United States, from health to education to community support. In the early writings of our foremothers, who were sisters, Providence is a Catholic nonprofit. They took care to identify the wealth of resources that we've been blessed with. And they have asked us to be good stewards of these resources. They've asked us further to be a good model of stewardship of these resources in healthcare. And we take that seriously, and our executive team takes that seriously. It's really helpful to have that kind of alignment and that kind of rudder. And my own background in that regard was a keen interest in environmental issues before I was a nurse. I mean, I was just horrified at the way that we handled resources and did not think about pollution. And that was 30 years ago. And really, I think understanding in more depth the operational imperative, how do you really get this done? I feel like in Providence, we're at a point where our leadership support is aligned with our business needs, and that is aligned with the needs of this planet. And I mean that seriously. What's happening in terms of our environmental and planetary health crises are pushing us to behave differently, to think differently about health, think differently about drivers of health, think differently about how that is entwined inexplicably with equity. We are always looking upstream at the social determinants of health, and now also to try and look at the environmental determinants of health, which overlap but are also distinct. We have developed the We Act framework, which stands for waste, energy, water, agriculture, food, chemicals, and transportation. So those are key inputs for greenhouse gas emissions. So we're working strategies on all of those and driving those down year after year. And we know that because we measure it. We measure that on the scorecard we've developed, the We Act scorecard, which tracks usage of different resources, the cost of those resources, and the carbon emissions from those resources. So we now have 5 years worth of data every month for every hospital, and now almost 80% of our clinics. And so we can really start to understand resource use and what happens when you decrease it. And I can tell you in a nutshell, you reduce your pollution and you save money. The ways that our environmental stewardship program really intersects with health is in several ways. One, that mitigation or the driving down of greenhouse gases is a longer term impact. We're dealing with the greenhouse gases that are already in the atmosphere right now. We're trying to drive them down, which really will impact the future more than today. But in that process, we are reducing chemical exposures in healthcare. We're reducing waste. We're reducing unnecessary resource use, which helps because we're more efficient in care delivery, and it reduces cost. Now, our resilience work, which is adaptation, that's dealing with the changes that are here now. So, for example, in 2021, we had 116 degrees in Portland, Oregon, and 108 in Seattle. Now, these cities aren't used to that. Our buildings are designed for, maybe max temperature of the high 90s. But we had 3 to 4 days of these extreme temperatures. We had more than 1,000 people in the ERs from the Canadian border to the California border. We had unexpected deaths from that. We had stress on our buildings in that heat such that the door jambs and window frames warped in one of our largest hospitals. That means we are not quite ready for that. And it is very hard to get ready for that just in terms of the delivery of care because we have 40 million square feet. So that's an important piece, is adapting to and preparing for these changes that are already here. Another piece is how do we help the people who are really at risk? What can we as a health system do to help prepare our own care delivery and our clinicians? And how do we find the people who are at risk so we can help with education, with outreach, with connections, with resources, et cetera? That's almost like a rescue approach, which we need to do. But we also are in a proactive planning approach as well, because we know what's happening. We can see it. We get warnings from the National Weather Service. We understand what communities are vulnerable and what populations are vulnerable because we've done that work. We've done an assessment of environmental justice impacts from Alaska to Texas to understand, well, what neighborhoods and what people and how do they know they're at risk and what can we do to help? One of our best resources in healthcare is knowledge. We have people who can actually go out and explain some of this. They can help people take care of themselves where they might not have thought about it. And that's something that we are doing. This movement of environmental stewardship in healthcare is picking up speed, but many hospitals haven't started. And they often will ask me, where do we begin? And it can be overwhelming, no question about it, because it splinters off into so many directions because our environmental impacts really touch everything we do. A lot of people would say, well, you've got to start with your leadership. I would say not necessarily, because a lot of times you have to convince your leadership. But very often what I have seen is that this bubbles up from concerned individuals. Start talking about it, start to tap into what might be available in the culture. So, I think health systems that do well tend to listen to the people who work there. Those are the experts, the people who are delivering the care, the people who understand how processes work. And so that is a good starting point. Listen to the concerns of the people who are serving the people that the hospital serves. For me, it's important to really be solutions-based. And I see solutions everywhere I look. It's amazing. It is so heartening to see the nation, in our case, coming together with these different leadership teams and agencies to see the globe really paying attention to healthcare specifically and health related to climate and our planetary crisis. I see solutions again and again and again, and I see them in our hospitals. I see them with our clinical staff. I see them with our nurses. And I think that can help relieve some of the fear and pressure that people may feel. And also, we need people to put their good minds to this and help carry this forward as we get through this admittedly challenging transition time as we move away from our greenhouse gas polluting practices and burning of fossil fuels.
Oh, wow. You were so right, Shanda. These nurses are sustainability ninjas. I feel myself smiling. I can't think of too many times when I talk about climate chaos where I'm actually smiling and feeling hopeful and getting really excited. So I just want to say thank you for that, how much I appreciate this, and for your leadership and your enthusiasm in helping all of us, and particularly leading that call for nurses to grab on to not only the opportunity, but to also own the responsibility. There is no way we're going to reach these goals without nurses at the lead. And I say that because of our expertise, but just by virtue of we are just the largest by a long shot of the healthcare workforce. And we also are the greatest contributors to the carbon footprint. So we have a responsibility and we have an opportunity. So I just want to say again, thank you for everything. This is so exciting.
Well, Shauna, thank you. And I want to underscore one word, and that is hope. If there's one thing that we do know we need unequivocally, it is hope that there can be progress. And we've seen that demonstrated with the momentum of change just in the past couple of years. And so when I think about what's coming down the pike, I only get more hopeful because this groundswell of action, man, it makes my job tougher every single day because everybody wants to do this. And I'm grateful to be here. So, Shauna, thank you again.
Shanda, it was a delight to meet you formally. I look forward to paths crossing in person. And let me just identify Practice Greenhealth, Healthcare Without Harm, as an extraordinary resource for organizations that are just beginning their journey or organizations that are well on their journey and have information to share with all of us who are really learning about not only our opportunity, but our responsibility to fulfill the commitments of our healthcare mission, which is not only the health of individuals, but the health of communities, and by extension, the health of our planet.
Thank you as well, John. It was a pleasure to share this space with you. I look forward to connecting in the future.
A whole wide world thanks to sustainability champions, cheerleaders, and clinicians, John Perlin, Shanda Demarest, Jessica Wolf, Emma Blakey, and Beth Shank. Every day, with urgency, optimism, and evidence, clinicians around the world are incorporating climate solutions as part of their practice to deliver safe, quality, equitable care for people, communities, and the planet. They recognize that all work is climate work. And as we pursue solutions in every corner of care, we can draw on inspiration from others taking action around us. For See You Now, I'm Shauna Butler. Thanks for listening.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.